Hi, good afternoon, everyone, and a warm welcome to our Facebook Live. Thank you all for joining us today on Facebook.
Before we go on, let us not forget to introduce ourselves. I'm Lai,
And I'm Khor.
and we are both pharmacists at Assunta Hospital.
Pleasure to be at your service.
This session is brought to you by Assunta Hospital in conjunction with the annual World Antimicrobial Awareness Week by WHO or the World Health Organization.
Yes, correct. One of the main aims of World Antimicrobial Awareness Week is to increase awareness of global antimicrobial resistance and to encourage best practices among the general public. And we are here to do just that. So before we get started, if you have any question during this session, please enter them into the comment box below.
We'll go through the questions in the Q&A section later, and we'll answer them to the best of our abilities. And also, please like and share this live video with your friends and family so they too can join us in this live session. So without further ado, Khor, are you ready for some myth busting?
Yes, sure. Let's do it.
Let's do it. So, United to Preserve Antimicrobials is the theme given to Antimicrobial Awareness Week this year, making it absolutely clear the importance of not just the involvement of the medical community, but also the involvement of the general public as well, in making sure what antimicrobials we have up until now today will remain viable to use in the future. So let us begin by understanding what antibiotics and antimicrobials are. So by definition, antibiotics are substances that are either of natural, semi-synthetic, semi-man-made it means, or man-made origin that kill or inhibit the growth of bacteria, thus also called as antibacterials. So antimicrobials, on the other hand, is a much larger group of substances which includes not only antibiotics but also include antivirals, antifungals, antiparasitics, and antiprotozoals. So antimicrobials, therefore, is an umbrella term. And to summarize this, all antibiotics are actually antimicrobials, but not all antimicrobials are antibiotics. So this image actually shows the different classes of antibiotics that are available. For example, beta-lactams, aminoglycosides, macrolides, or cephalosporins. So you can actually imagine this is only antibiotics, but you can actually imagine by this how big it is, the family of antimicrobials are.
Yes, true, Mr. Lai. So, to appreciate the importance of antibiotic, we must first understand what happened before antibiotic exists and how antibiotic was discovered. Infections and infectious disease have always been in existence as far back as human history goes. In fact, microbes are the first living organism on Earth, not human, not dinosaur. Ancient Egyptian, Chinese, Greeks were found to have applied most topically to treat wounds. Not knowing the true nature of infectious disease, various herbs and remedies such as honey were used to treat infections. The incomplete knowledge on disease and also infection alongside with the absence of antibacterial agents during the pre-antibiotic era made infections, injuries and also medical procedure very risky and life-threatening. Could you just imagine a simple cut could mean that you may die in a few more days? That is very disastrous.
Yep.
It was not until the late 19th century that the cause of infections began to be identified and recognized. And penicillin is one of the very first antibacterial substances to be identified, and where the term antibiotic was only coined later in the late 1940s. In fact, penicillin was discovered by accident by microbiologist Dr. Alexander Fleming in 1928 when he noticed that a fungus, Penicillium notatum, had created a bacterial-free zones wherever it grew on the plate of bacteria he has been working on. And some additional facts, although penicillin was first discovered in 1928, but the penicillin mass extraction and production was not until 1940s due to technology limitation. So, the first antibacterial that available in the market is the sulfonamide antibiotic at mid-1930s. So, as we move forward, we have reached to the point where the discovery and introduction of new antibiotics has started to stagnate, an era known as post-antibiotic era, with new antibiotic resistance catching up and little new antibiotics being discovered. We will soon face a crisis in treating infection. the similar situation before the first antibiotic was available. If this persists, we will soon lose our battle against bacteria. Unfortunately, inappropriate use of antibiotic has been the leading factor. As a pharmacist, we have come across various myths and questions in our practice, not only from our patients, but also some from our own colleagues, friends, and families. Hence, our focus today is to debunk some of the common myths regarding antibiotics in our community. So, I shall start with the first myth or question, and I'm sure you know the answer actually.
Yeah.
Okay, so the first question or the common question that I always receive is that can antibiotic cure or since I know infection is caused by bacteria, can I just take antibiotic to prevent me from getting any infection?
Well, this myth is actually very, very common. And this myth is just too good to be true, actually. So the answer is no. Like I've mentioned earlier, antibiotics will only work on bacterial infection. And there are multiple classes of antibiotics. So obviously, one single type of antibiotics is not going to be effective against every single type of bacteria that is in existence out there. All right. At the same time, diagnosing and differentiating between viral or bacterial infections has always been challenging. All right. And if you use antibiotics not knowing whether is it a bacterial infection or a viral infection, it can actually delay the use or the administration of proper treatments. So examples of viral infection that people will usually think that might need antibiotics for are common cold, seasonal flu, chickenpox, and even dengue fever. So, following on the same line, right? So the one stone kill all birds myth, right? So people will still think that because of that, it is always a good idea that I keep a course of antibiotics at home. What do you think, Khor?
Okay. So this definitely not a good idea, as Mr. La has mentioned earlier. So whether you need to take antibiotic or not is actually depending on whether you really need that antibiotic because of the infection that caused by bacteria or not. And in fact, if you do actually you have an infection and the infection is actually caused by bacteria, the selection and also the duration, the dose, how do you select the dose, duration also requires specialized knowledge on the disease state or what are the common the bacteria that actually causes the infection, and also whether the antibiotics that you keep as a cost, as a spare cost, whether will be effective or not. So if you do not know about this, better leave all this to the professional, or in this case will be the doctors. So moving on, follow up from that question actually, now I won't have any full course of antibiotic, but I have a leftover antibiotics. God know how I actually have a leftover antibiotics, but is it perfectly fine if I use it this time since I'm feeling the same symptoms or same discomfort as last time?
The quick answer is no. But there are two issues actually with this myth. First of all, why are there leftover antibiotics, right? There shouldn't be any leftover antibiotics in your possession. But you hang on to this myth because we're going to address this myth later on. All right. The second issue in this myth is that self-diagnosing or self-diagnosis based solely on how you are feeling or your symptoms is going to do more harm than good. All right. Feeling tired, lacking in energy, feeling feverish, and even coughing can actually point to different types of diseases or infection. And now you are doing self-medicating, right? You're self-medicating yourself. Then you run a risk of having yourself under or over-medicated, and which is not helpful in treating the disease, but at the same time, it can lead to the rise of antibiotic-resistant bacterial strains.
Correct.
So now we still follow that there are still leftover antibiotics, right? But in this case, I'm not taking it, but because right, sharing is always caring. So now I'm sharing it with my friends or family because I think, right, they're still having the same symptoms that I'm having. They're coughing, they're sneezing, they're having runny nose. So is that even a good idea to do it?
Okay, as you have mentioned earlier, since we don't recommend you to be taken by your own self for the leftover, definitely we won't recommend you to share it with others. And unfortunately, in these instances, sharing is no longer caring. Once again, we would like to discourage self-diagnosing and also identifying certain diseases because based on the limited knowledge on the disease, you can't really diagnose what infection you have properly. Okay, And sharing of medication, be it antibiotics or otherwise other medication, is especially hazardous because the choice of medication, the dose selection, the duration always very specific to a particular individual and require consideration on their medical or medication history. Like for example, do you have a liver impairment or liver problem, kidney problem, or also history of allergy to any medication or not? Okay, so if you do not know all this, but you are actually sharing your medication with other people, remember what works for you might be harmful to others. So this is definitely not a very good idea. And next myth will be, this might be related to the leftover. Okay, so can I just stop taking my antibiotic if I feel better because uh, seems to be no point for me to continue the balance of the medication. So is it correct?
Well, I can't say how widespread this myth is actually, right? So this actually addresses why there are leftover antibiotics at home.
Yeah.
So never do that, all right? It is always crucial to complete the course of antibiotics given by your doctor, and it's always good to keep that as the rule of thumb or golden rule, right? With the only exception when you are having allergic reactions, unable to tolerate the antibiotics, or you are specifically instructed by your doctor or pharmacist to stop the medication. But even in those cases, right, when you are asked to stop those medication or the antibiotics, the doctor will actually replace that with another type of antibiotics which you can take so that you can complete the entire course of treatment. So completing the course of antibiotics is to ensure all of the target bacteria is cleared from the body and leaving none behind to grow or develop into resistant bacteria. So in this case, in the world of bacteria, the evolutionary law of the survival of the fittest actually applies still. And what doesn't kill them will really actually make them stronger. Okay, so the next myth is actually related to the misunderstanding on antibiotic resistance or the fear, all right, the fear on antibiotic resistance. So people might choose not to even take antibiotics, or when they say, no, I always finish my course of antibiotics, so I run no risk of getting antibiotic resistance. So is that even true?
Okay, unfortunately, it is not necessary. First thing we have to get it right is that our body doesn't develop antibiotic resistance, but the bacteria does. And we actually acquired or host the bacteria. As mentioned by Mr. Lai earlier, bacteria are following the rules of survival of the fittest. So they will actually mutate to be in order to actually survive, okay, to stay alive. And because of this, the resistance actually can be developed elsewhere outside the body as well. Okay, not only in our body they can actually acquire the resistance, but they can also acquire the resistance from in the livestock due to the overuse of antibiotics in farming. Okay, overuse or misuse by other people, and also acquired from the environment, from the waste, water, or soil. Okay, so even if we do not have any antibiotic resistant bacteria, but if our colony or our bacteria in our body actually come into contact with bacteria that has the antibiotic resistance, there are instances where the resistance information can be passed to our non-resistant bacteria. Okay, so this means that even if we follow or okay, but we will still have a chance to actually acquire the antibiotic resistance. Okay.
So from what you can see here is actually that it means that it's not one person's fault. It's actually everyone's responsibility to ensure that resistance doesn't form.
Yeah, and this doesn't mean that you cannot use antibiotic. You only use it when it is necessary, because when you are being prescribed with antibiotic means that you are really needed it. And in these instances, you the risk for the benefit will be better than the risk. In this case, you should take it. Right. So let's move on to the next myth. This is something unique, but I still received this question before. Okay. There are people thinking that antibiotics that are taken more frequently in a day are actually more effective. So is it correct?
All right. So the answer for this It depends, right? It depends because there are actually many factors at play in this particular myth, right? The frequency of taking your antibiotics depends on the way an antibiotic acts in your body, which we call it pharmacodynamics in the field, right? Its formulation, whether is it in a capsule form, a tablet form, in syrup form, or what your body does to the antibiotic, we call it pharmacokinetics, because all of this will actually affect the level of medication or how long the medication or the antibiotic stays in your body or in your system. All right. So, for example, if somehow the level in your body stays longer, then which means you do not need to dose yourself as frequently. But let's say if the level stays in your body in a very short period of time, then that means you need to take more frequently so that you can reach a certain effective level in your body. All right. So this there's another concept of the concentration dependent killing or time dependent killing of antibiotics. So that is another concept that actually affects whether do you really need to take your antibiotics that frequently. So in generally, right, it is not a good idea to actually judge the superiority of an antibiotic given by a doctor just by its frequency. Sometimes when you think about it, right, if you need to take your antibiotic less frequently, it's actually better, right? Because less frequent taking means there is less likelihood that you will miss a dose, and that will translate to better compliance and in the end, better treatment outcome.
Yes, correct.
So while some might believe that taking more frequently is actually making the treatment more effective, but there are some that might think that taking higher strength of antibiotics are actually more effective. So what do you think of?
Okay, so similarly as what have been mentioned by Mr. Lai, you have to understand that dose doesn't equal to strength. And in antibiotic wise, we actually measure the effectiveness by how many doses you have actually been taken. Okay, and apart from that, also effectiveness is actually determined by the types of antibiotic and also how they're being used by our body. To make it simple, the same amoxicillin 500 mg capsule is actually equivalent to 2 capsules of 250 mg. Okay, so doesn't mean that you take 1 capsule of 500 mg capsule will be better than you take 2 capsules of 250 mg, although the 250 mg is actually lower strength. So if you compare as such, the dose will play an important role here. Okay, but however, if you are comparing the same dose, like for example, proxacillin 500 mg versus amoxicillin 500 mg, these two are not equivalent. You cannot just compare based on the dose wise. Okay, this is akin like comparing apple and oranges. So it depends on what criteria you're looking at. If let's say you're looking for tanginess, definitely oranges would be better. Although apple has the sweetest, it is the sweetest actually. So depends on what you are looking at actually. So different antibiotic, different dose, different strength. Okay. So we'll move on to the next myth, and I think it's very relevant in our settings actually. Okay. So it's more as antibiotic that are more expensive, whether they are more effective.
Okay. So the answer to this again, it is not necessarily true. All right. Although many people might like to believe what they are paying more is actually better. All right. But we have to look at this. In this case, right, we have to look at two types of comparison. The first type of comparison is that we're looking at the same type of antibiotic. Means, let's say, amoxicillin with another amoxicillin, but of different brands, right? So one brand will sometimes more, or most likely be more expensive than the other. Okay, so assuming in this case that we know that this antibiotic works for a particular type of infection, so as long as these two brands, right, are proven to be bioequivalent, then they are equally effective. So by bioequivalent is that these two medication actually creates the same concentration graph that you see earlier in an earlier myth. All right, if they create the same concentration graph, then which means they are actually bioequivalent. Okay, so you can actually look at this like with an analogy using two sedan cars, right? So let's say we are going from one point to another point on a highway, and both the sedan can actually allow you to reach your destination with the same amount of time. So in that case, both sedan A or sedan B are equally effective, regardless of the pricing of the cup.
Mm-hmm.
All right. So of course, with cars, right, there are difference in terms of comfort level, right? You may say if I take the car that starts with the alphabet M, right, very expensive, so it's actually more comfortable. All right. So in even in the antibiotic sense, right, certain doctors might find that the more expensive ones, or yeah, clinically they will find that it has actually less side effects than the generic ones. Okay, but it is just in terms of the incidences of the side effects. All right. So the second comparison is when you are comparing two different type of antibiotics, right? Entirely different. So in this sense, we have to look at what is the purpose you're using it for, or which is the target bacteria that you are targeting in the treatment. All right. So we are using back the same analogy.
Okay.
2 cars now, but now you're actually planning to go to your friend's durian farm, which is off road. Okay. So now it's actually more effective if you are using a 4x4 pickup rather than using a sedan car, right? So that is how we look at this pricing thing. So price doesn't really tell the effectiveness of your antibiotics. Okay, so moving on to the next myth. All right, this is also a very common one because people will believe sometimes, yes, allergies can be quite scary, right? Allergies can be dangerous also. So people will think that if I'm allergic to penicillin, I should not be taking any other types of antibiotics as well because I might be allergic to it as well. So,
but in this sense, it is a good news because the answer is no. Okay, we will have to understand that penicillin, or if you're allergic to sulfonamide, okay, penicillin or sulfonamide is just one type of class of antibiotics. And being allergic to a class of antibiotics doesn't make you automatically allergic to other class of antibiotics. And apart from that, also we will have to differentiate between allergy and also side effect. Okay, in terms of allergy, is almost always related to how your immune system actually responds to the drug. Okay, causing side effects such causing those reactions such as rashes. Okay, inflammation. Okay, whereas side effects are actually related to the inherent property of the drugs. Like for example, some antibiotic actually will cause diarrhea or stomach ache. Okay, that is not allergy. Okay, that is a side effect. So why we have to differentiate between allergy and side effect, because if you are allergic to any medication, okay, usually we will not recommend you to take the same medication unless there is no other choice. Okay, but if you are experiencing side effect, that is different case. Because side effect, sometimes you can tolerate, sometimes you cannot. Okay, and this is very important to inform your doctor on your drug allergy, because by informing a doctor on a drug allergy, they can determine whether you really have actual allergy or is a side effects. And if it's an actual allergy, then you should actually get a drug allergy card from your healthcare professional or from the doctors and carry it wherever you go. Because in case one day you are touch wood, you are actually being found unconscious, okay, and you're actually required to be administered with antibiotics. At least the one who actually found you will know that you're allergic to certain things, and they won't add any problem on your misery. Okay, so always carry your drug allergy card wherever you go. Okay, and same topic on the allergy, but this one I find it actually a little bit funny. Okay, but still it is a relevant question. Okay, so can antibiotic allergy be transmitted just like disease?
All right. The good news on this is also no, it won't. Right? It won't be transmitted to another person like bacteria or viruses does. All right, because allergy has relationship with the body immune response, so it cannot be spread to another person. But however, since it's a body immune response, so it might be genetically linked. So certain allergies may run in a family. But the keyword here is may. Means let's say if your parents had allergy to penicillins, you may or may not have it. So get it checked with your doctor whether the response that you are having with penicillin, for example, is it a true allergic reaction? Right? So let us move on to the $1,000,000 question. Is it using 2 or more antibiotics? Is that always better or more effective?
Okay, the quick answer will be it depends. Okay, it is not wrong that actually combining two antibiotic will be better than that, but it always has to be depends on what situation you are actually referring to. Like for example, in most common mild infection or non-complicated infection, usually one antibiotic is sufficient. Combination will be better or considered in a following situation where, first of all, when the doctor actually suspect you have multiple bacterial infection, and during the initial treatment where they need to cover or they need to actually treat all those bacteria, to kill all those bacteria before the culture actually come back. So in this case, it is wise to actually combine antibiotics, okay? And also in situation where you have a severe infection, okay? And using a single antibiotic will result in a high dose related side effect. So by adding on another antibiotics, you can actually use a lower dose, okay? And certain antibiotics will complement each other when combined. And some example will be aminoglycoside together with cephalosporin or with penicillin, okay? And in instances where the infection is caused by antibiotic resistant bacteria, so you have no choice. You will need to use more antibiotics or combination antibiotics to actually achieve the therapeutic effect that you want. And also at a condition where if the bacteria are prone to develop antibiotic resistance, using combination antibiotics will result in a less likelihood that the bacteria develop resistance. So it really depends on the situation when you need to use combination or whether combination is better or not. If one antibiotic able to work and and the body is actually doesn't really resistant to it, so the bacteria not resistant to it, so why you need to use two? Yes.
All right. So we have addressed all our myths today.
Yes.
But let's say if you have forgotten everything else we have mentioned earlier. So there are these 4 take-home messages for everyone. First, antibiotics are not the answer to every kind of infection.
Yes, correct.
Only use antibiotics when you are advised by your doctor or pharmacist. Okay, and antibiotic resistance is a real growing threat to humanity now, and it is everyone's responsibility to put a stop to it. Okay, so it is very important to handle your antibiotics with care, and if you do encounter any problems with your antibiotics, please refer to your healthcare professionals.
Yes, correct. So before we end our slide, let us go through some key points regarding on how to use your antibiotic based on the common dosage form available in outpatient. I will start off with capsule and tablet first. Okay. So as a rule of thumb, antibiotics should be taken at the same time every day. Okay, and it should be around the clock instead of like three times a day, 2 times a day. Okay, so for example, if you are being prescribed with 2 times a day, it should be every 12 hours, where we will suggest to be taken at 7 a.m., 7 p.m. If it's 8 hours, or 3 times a day, it will be every 8 hours, 7 a.m., 3 p.m., 11 p.m., or 4 times a day, every 6 hours. Okay, whether the antibiotic capsule or tablet to be taken before food, with meal, or after food will be depending on which type of antibiotic that you receive. Okay, some antibiotic need to be taken before food because food will actually result in a lower absorption of this medication into your body. Okay, some antibiotic will be needed to be taken after food to reduce the side effects such as nausea or vomiting. Okay, but there are some antibiotics with special precaution, like for example, ciprofloxacin. Usually, we will not recommend to take together with antacid zinc iron preparation because this 3 preparation will actually result in a lower absorption of the ciprofloxacin into your body. And so same with doxycycline, with antacid milk iron preparation, and also we recommend to take in an upright position with large amount of water. As a rule of thumb, capsule tablet, unless it's being advised otherwise, if not, then it should be actually stored in a cool and dry place.
All right, then we move on to syrup and suspension, right? So in terms of the timing of dosing, it's very similar to capsule or tablets, all right? But one key point, there are a few key points with suspension. First of that is actually to shake before using, all right? There are suspensions that actually needed to be shaken well before use, but some, there are specific instructions that you shouldn't shake it too rigorously, okay? For example, like Zinette suspension, or classic suspensions, right? Because shaking too hard may actually cause the suspension to turn bitter, and it will be so much more difficult to feed your child, your young child, with bitter medications. Okay, then you should always measure the suspension or syrup with proper measuring cups or syringes that has been provided to you by your pharmacist or your doctor. All right, that is to ensure the dose is accurate.
Yeah.
Okay. So lastly, in terms of storage, okay, generally it is to keep refrigerated after reconstitution. Again, there are specific suspensions, antibiotic suspensions that do not require refrigeration. For example, azithromycin or Zithromax. Okay, so the shelf lives for this antibiotic suspension actually varies. Okay, in between 5 to 14 days. You can always check with the product insert on how long you should be keeping it. Okay, otherwise, even easier, check with your pharmacist.
Okay, so moving on, topically, we have cream and ointment. So similarly, because it contains antibiotic, you should actually apply at the same time every day if possible. And ensure that you apply sufficiently to cover the affected areas. If not, you will be actually under treating your wound. Okay, but another key point here is that because it contains antibiotic, okay, you can only use it, or you should use it only if it's being prescribed or dispensed by healthcare professional. If not, the alternative will be antiseptic cream, okay, or ointment, okay. And generally, cream and ointment you should actually store at cool and dry place unless being advised otherwise. And also a rule of thumb is that if for cream and ointment after open, you can actually discard the remaining after 1 month, or as per recommended by the manufacturer.
So finally, you will also see antibiotic eye drops and ointment given to you as outpatient. So because it contains antibiotics, so we should still instill or apply them at the same time every day to ensure the effectiveness. Okay. Similarly, keep at room temperature or refrigeration or refrigerated, if you have been instructed to do so, because different products will require different types of storage condition. So generally, you will be instructed to discard your eye drops or ointment 28 days to 1 month after opening.
Yes. So always refer to your the label on the bottles or on the envelope of the antibiotics to see what are the instructions that we actually advise you to do. Okay. So I think that's all for today. Okay. Now we'll move on to address all those questions that are in the Facebook. But you may still actually drop in your question at the comment at box below. Okay. So we will try to address every single one if it's possible. Okay. So let's move on to the first question that we have.
All right. Now we're starting off with the first question from Rachel. So how should I dispose I believe it's unused medications, especially antibiotics? All right, this is a great question. Okay, so usually medications, right? Any unused portion, okay, you can always return them to the nearest pharmacy. Okay, whether is it usually government hospitals or government clinics will offer those kind of services. Just bringing that back to them, saying that this is the unused portion, then the pharmacy will help you to dispose it properly, right? Antibiotics is important because if you dispose them, if you throw them into the garbage, or you flush them down the drain, then it can cause problem, which means the contamination of the environment can actually lead to antibiotic resistance.
Yes, especially on sewage, you should not actually throw it into sewage because sewage contains a lot of bacteria, microbes. Okay, the antibiotic resistance will actually develop easily at that place. Okay, and also just remember, if you have any extra medicine, or just bring it back to any other pharmacy, okay, we will actually help you to dispose it, because what we'll do is more often than not, we actually incinerate that unused portion or the leftover or expired medication. Okay.
All right, then we move on to the next question from Facebook as well, from Edmund. What affect the effectiveness of antibiotic? Taking antibiotic after meal affect the effect of antibiotics? Yeah, I believe you mentioned something like that.
I think we addressed earlier on. Okay. So the food itself will actually affect the absorption of antibiotics, and also in some instances the food, like for some of the substances like also antacid, will actually reduce the absorption, okay, by binding or by blocking the absorption of the antibiotics. Okay, so always refer to your leaflet or to the on your label. Okay, whether you should take it with food, after food, or before meal.
All right. I think that's all the questions we have. Any more questions from Facebook? All right, dear viewers, if you have any more questions,
Yes.
do send in with us. We still have a little bit more time to address those questions.
Yes.
So you're most welcome to send in your questions.
So, like, what do you think about Antimicrobial Awareness Week? So, do you think this event has been actually broadly, uh, I mean, being exposed enough in our public, or is it in our community?
Yeah, it has been going on for many years actually. But I think the exposure that has been given to the public is still very limited, especially in Malaysia. So actually, we are doing our little part here to actually keep everyone informed and increase the awareness in terms of antibiotics, right?
Okay, in terms of just to add on certain things which I have mentioned earlier on. Okay, so there are some instances that you might actually be told by a doctor or by your doctor to actually keep a course of antibiotic at home, but that is under doctor instruction. Okay, I have to make a clarification here because there are certain instances where the doctor will actually already know that you have infection, but it is not severe enough for you to actually start antibiotic. But instruction has been given that in that instances it is correct for you to actually have a course of antibiotic at home ready if you are really needed. Okay, but that is under doctor instruction. What I mean is that it is not under your own instruction or your own initiative to actually get a course of antibiotic just to keep at home. Okay.
Yeah. All right, I think that's about the time we have for today. So thank you everyone for joining us today on this session. I hope you enjoy it as much as we do.
Yes.
Right, we are having a great time here.
Okay.
Okay.
So and before we end, just want to inform everyone that from Assunta Hospital, we actually have a service known as a park and collect service and also a home delivery of medication. So during this CMCO period, we are actually offering a free delivery service for all medication or for all patients who actually are eligible for it. So to check out with us, call us up at our outpatient pharmacy department for more information.
All right. Once again, thank you so much for joining us. Do take care.
Yep. Stay safe.
Stay safe. And we hope to see you again in our next Facebook Live from Assunta Hospital.
Okay.
Bye-bye.
Bye.